presentation by the Florida Healthcare Association by Emmett Reed, Executive Director of the Florida Healthcare Association. Mr. Reed, it's great to see you.
Our facilities have shown incredible resilience and unbelievable commitment, going in every day, taking care of Florida's frailest and elderly throughout the state, and we're very proud of them. We care for those that are the highest at risk to get COVID and the most affected by COVID. The average age of our resident is 85 years old. Most of them have underlying medical conditions. And, a nursing home is supposed to be home-like. So we have congregate living, right? We have dinners together. We have bingo together. We have activities together. They share rooms in the physical plant, all making it a very difficult environment to manage a pandemic like COVID-19. Today, 97% of residents are COVID-free. 98% of staff are COVID-free. And the average throughout the pandemic was 98% of staff and residents being COVID-free. At the height of the spread, you had a 97% of the residents being COVID-free and 95% of staff being COVID-free. If you look at that throughout the country, you'll see that Florida achieved, per 1,000 residents, achieved unbelievable progress compared to most of the country.
I think it's wonderful to be able to hear also a lot of what was done right and how Florida led the way when it came to how we reacted to the virus very early on in long-term care facilities. We were, correct me if I'm wrong, we were the first state to lock down our nursing homes after the USDVA did at the federal level.
Correct.
I don't think there was anybody before us.
And I will say that Governor DeSantis had an opportunity very early on to allow hospitals to place COVID patients into nursing homes without testing them or require the testing. He required the testing. That saved thousands of lives. All you have to do is look at New York and New Jersey to see what happened there. And so, again, it's collaboration, it was communication during a very, very difficult time. So our healthcare heroes worked to keep the residents in communication with their family, either through technology with iPads and technological Zoom visits, drive-by parades, window visits. They would, when they weren't allowed to congregate anymore, the staff got creative and everybody came out in their doorways and they had hallway bingo or they had musical events. They served as clergy, the staff did. They asked the community to send flowers and letters to the residents of the nursing home. Our members are what we call them healthcare heroes for many, many reasons. But it's not lost on me, and it shouldn't be lost on this committee, that many of those members would go home at night after taking care of COVID patients and after taking care of our grandparents, grandmother, grandfather, aunts and uncles, brothers, sisters. They'd go home at night and they'd sew their own masks. They would take garbage bags and use them for PPE. So I'm really proud of them and I'm proud to represent them, and they are heroes for doing that.
Mr. Reed, I want to thank you for something that's very unique to see. At some point in your presentation, you choked up because of how proud you are of the frontline people and how hard they worked and how they did without and made use. And it's becoming increasingly rare and unique to see that. And I really appreciate your authenticity and feeling that way.
And I know the challenges that you faced because I've got the phone calls from loved ones who could not see their loved ones, from family members who were so distraught that they couldn't see their loved ones. And the fact that you did the bingos and things of that sort, is just wonderful.
If you have recommendations as to policies, guidance, things that we could put in place that would, help require, direct, encourage homes to, be able to have what would be an adequate level supply? How can we avoid shortages in the future to, prepare for that next event? That would be super helpful for us. So thank you, and thank you for all you do, and thank you for being such a great communicator, not just to this committee, but to your membership and putting out the guidance. We received all the time, about the need to communicate with your residents, families, their loved ones, their caregivers, their whoever it may be. The point of contact to that member, that was critical, and that helped that helped us all get through this together. So I appreciate you putting that out.
It's really, the rules are set as far as the guidelines, and they're pretty, don't want to say loose, but the guardrails are pretty wide, and it's by a nursing home by nursing home situation gets to decide that. But most want to continue to increase visitation coming in. We're seeing numbers decline now rapidly, and I think you'll see the doors open wider and wider. Some of the things that a nursing home has to keep in mind when they're considering if there's an outbreak, for instance, and an outbreak can be an outbreak of one. So outbreak sounds like 100 people have it. An outbreak can be one. It just depends on their staffing. Are they staffed highly enough to safely allow more people in? But I can guarantee you that every nursing home wants to open back up to visitors as soon as they possibly and safely can.